Vitamin B12 is a vitamin available in many formulations to correct vitamin B12 deficiency. In this video, let's found. What is cyanocobalamin? What is cyanocobalamin used for? Contraindication. What are the side effects of taking cyanocobalamin? How does cyanocobalamin work? How to use cyanocobalamin? Dose. Nutritional supplementation. Recommended daily allowance, RDA. Greater than 19 years, 2.4 micrograms. Pregnant women, 2.6 micrograms. Breastfeeding women, 2.8 micrograms. Dietary supplement, 50 to 1000 mcg/day. Pernicious anemia. Manufacturer recommendation, 100 micrograms IM/SC once daily for 6 to 7 days, then every other day for 7 doses, then every 3 to 4 days for 2 to 3 weeks, then monthly. Alternative parenteral dose, 1000 micrograms IM/SC once daily for 7 days, then weekly for 1 month, then monthly. Nasal spray, 500 micrograms, 1 spray in 1 nostril, weekly. If patient is taking hot meals, spray should be administered 1 hour before or after meal. B deficiency. Initial, 30 micrograms IM once daily for 5 to 10 days. Maintenance, 100 to 200 micrograms IM monthly. Nasal dose, 500 micrograms once weekly. Limitations of use. Nasal spray should not be used for the B12 absorption test, Schilling test. In patients with correctable or temporary causes of vitamin B12 deficiency, the benefit of continued long-term use of nasal spray following adequate correction of vitamin B12 deficiency and underlying disease has not been established. The effectiveness of nasal spray in patients with active symptoms of nasal congestion, allergic rhinitis or upper respiratory infection has not been determined. Treatment with nasal spray should be deferred until symptoms subsided. What is cyanocobalamin used for? Nasal spray. The cyanocobalamin nasal spray is indicated for the maintenance of vitamin B12 concentrations after normalization with intramuscular vitamin B12 therapy in patients with deficiency of this vitamin who have no nervous system involvement. Injections, subcutaneous, intramuscular. These forms are indicated for vitamin B12 deficiencies due to various causes, with or without neurologic manifestations. Oral forms. Vitamin B12 supplements are widely available and indicated in patients who require supplementation for various reasons. Dose requirements for vitamin B12, which are higher than normal, caused by pregnancy, thyrotoxicosis, hemolytic anemia, hemorrhage, malignancy, hepatic and renal disease, can usually be achieved with oral supplementation. Oral products of vitamin B12 are not recommended in patients with malabsorption. These forms are primarily absorbed in the gastrointestinal tract. Contraindication. If you have any of the following health problems, consult your doctor or pharmacist before using this medication: a certain eye disease, Leber's optic neuropathy, a certain blood disorder, polycythemia vera, gout, iron or folic acid deficiency anemia, low potassium blood levels, hypokalemia. Contraindication. If you have any of the following health problems, consult your doctor or pharmacist before using this medication: a certain eye disease, Leber's optic neuropathy, a certain blood disorder, polycythemia vera, gout, iron or folic acid deficiency anemia, low potassium blood levels, hypokalemia. Side effects. Possible side effects of cyanocobalamin injection include allergic reactions such as hives, difficult breathing, redness of the face, swelling of the arms, hands, feet, ankles or lower legs, extreme thirst, and diarrhea. Less serious side effects may include headache, dizziness, leg pain, itching, or rash. Pharmacodynamic. Cyanocobalamin corrects vitamin B12 deficiency and improves the symptoms and laboratory abnormalities associated with pernicious anemia, megaloblastic indices, gastrointestinal lesions, and neurologic damage. This drug aids in growth, cell reproduction, hematopoiesis, nucleoprotein, and myelin synthesis. It also plays an important role in fat metabolism, carbohydrate metabolism, as well as protein synthesis. Cells that undergo rapid division, for example, epithelial cells, bone marrow, and myeloid cells, have a high demand for vitamin B12. Parenteral administration of vitamin B12 rapidly and completely reverses the megaloblastic anemia and gastrointestinal symptoms of vitamin B12 deficiency. Rapid parenteral administration of vitamin B12 in deficiency-related neurological damage prevents the progression of this condition. Mechanism of action. Vitamin B12 serves as a cofactor for methionine synthase and L-methylmalonyl-CoA mutase enzymes. Methionine synthase is essential for the synthesis of purines and pyrimidines that form DNA. L-methylmalonyl-CoA mutase converts L-methylmalonyl-CoA to CoA in the degradation of propionate, an important reaction required for both fat and protein metabolism. It is a lack of vitamin B12 cofactor in the above reaction and the resulting accumulation of methylmalonyl-CoA that is believed to be responsible for the neurological manifestations of B12 deficiency. Succinyl-CoA is also necessary for the synthesis of hemoglobin. Vitamin B12 incorporates circulating folic acid into growing red blood cells, retaining the folate in these cells. Half-life. Approximately 6 days, 400 days in the liver. Dose. Nutritional supplementation. Recommended daily allowance, RDA. Greater than 19 years, 2.4 micrograms. Pregnant women, 2.6 micrograms. Breastfeeding women, 2.8 micrograms. Dietary supplement, 50 to 1000 mcg/day. Pernicious anemia. Manufacturer recommendation, 100 micrograms IM/SC once daily for 6 to 7 days, then every other day for 7 doses, then every 3 to 4 days for 2 to 3 weeks, then monthly. Alternative parenteral dose, 1000 micrograms IM/SC once daily for 7 days, then weekly for 1 month, then monthly. Nasal spray, 500 micrograms, 1 spray in 1 nostril, weekly. If patient is taking hot meals, spray should be administered 1 hour before or after meal. B deficiency. Initial, 30 micrograms IM once daily for 5 to 10 days. Maintenance, 100 to 200 micrograms IM monthly. Nasal dose, 500 micrograms once weekly. Limitations of use. Nasal spray should not be used for the B12 absorption test, Schilling test. In patients with correctable or temporary causes of vitamin B12 deficiency, the benefit of continued long-term use of nasal spray following adequate correction of vitamin B12 deficiency and underlying disease has not been established. The effectiveness of nasal spray in patients with active symptoms of nasal congestion, allergic rhinitis or upper respiratory infection has not been determined. Treatment with nasal spray should be deferred until symptoms subsided. Safety advice. Cyanocobalamin is generally safe to take in pregnancy and while you are breastfeeding. You do not usually need to take vitamin B12 supplements when you are pregnant or breastfeeding, unless your doctor has advised you to.